I think we're going to go ahead and get started. I am Jackie O. Shumway, and yes, I get that name because I run a pumpkin patch in Park Hill. So I'm Jackie O. Lantern Shumway during the month of October, which is why you'll see me limping as I was picking pumpkins up and moving them around last night afterwards. But I'm just kind of telling this because I don't always walk like this. All right. So I should tell you right now that this expo is going really well, and we are so lucky to have Kathleen Blazek here. And I want to tell you a little bit about her. First, I'm just going to tell you this. She is she's very sincere, and she's an excellent person to, give you some information. I think those of you that don't know about injection therapy, if you're a practitioner, this is some stuff. She actually has a training program, and we got some information in the back for people who want it. But honestly, also to understand what the injection stuff is, because it has different scopes in different states. Okay, so I'm going to actually let her explain that. So let me just tell you a little bit about her. And if I don't put my eyeglasses on, I have pumpkin seeds in my eyes. Okay, here we go. So Dr. Kathleen Blazek is a doctor of acupuncture and Chinese medicine and the owner and clinic director of Point Balance. Acupuncture in Colorado Springs. The director of Point Balance Acupuncture in Colorado Springs. Why is that broken up? She has been practicing acupuncture since 2016, holding graduate degrees from Colorado Chinese Medicine University and the Pacific College of Oriental Medicine. So Dr. Blazek, before she entered medicine, she spent 8 years as a registered respiratory therapist at UC Health in Colorado Springs, working in cardiopulmonary emergency and trauma units, acute care, and the neonatal intensive unit. So she kind of has a little bit of experience. What do you think? Okay. Her Western medicine background includes extensive experience with arterial line placement and arterial blood draws, which is kind of, interesting. So her advanced training in injection therapies bridges Eastern and Western approaches. And I would just leave you with that, because she is going to present some of the best stuff to you. What, do you think she's qualified to be talking to us? Okay. Anyway, I'm going to give her this, and I'm going to let you, I think we talk into this, and the mic is recording it for the, I think, online stuff. So I'm figuring this out. Here you go, Kathleen. Thank you.
Thank you
All right.
for that intro. Good morning. I think we're still in morning. I was telling Ken that his speech on tea reminded me of a historical fictional book that I had read recently. And it was called The Tea Girl of Hummingbird Lane by the author L.C. And he said, yes, I know that book because the foreword was written by him. For you or by you? An acknowledgement to him in that book, which I did not know. So small things bring us together in this big world. And I thought that was wonderful. But it's a great book if you have a chance and if you love historical fiction. And it talks about pu'er in that book. Well, you've already got my introduction, so we won't go into that. But I want to say how pleased I am to be here today. I love acupuncture. It is my jam. And let me tell you, going from an allopathic Western medicine into Eastern medicine was a very hard decision to do for me when I did that back in, gosh, what was that, 2013, I believe, 2012, when I started the process. And I always thought I had to choose between one or the other. But I'll tell you, as modern medicine evolves and as Eastern medicine evolves, we're seeing that we're actually handshake quite a bit. And there is no need to draw a definitive line between us. The lines are only drawn by attitudes, not by the medicine. I have a master teacher who has been teaching me for the last 3 years. And he is a neurology thinking teacher. He is a Chinese medicine practitioner. His name is Dr. Pony Chang. And if any of you have ever heard of him, he has a practice out of Toronto, but he teaches all over the world. And he made a statement to me that has always stuck with me. And he said, back thousands of years ago, Chinese practitioners were the first neurologists. And I agree with that. The more I study acupuncture, Chinese herbs, and I see how we integrate so well within the movements of the human body, there is no doubt to me that if we could forward those people from thousands of years ago and bring them to here today, they would be an enlightenment to how our medicine is powerful in the field of neurology. So my talk today basically is to hit these points of discussion. There is a legal allowance that we have to abide by for injection therapies within acupuncture. We'll go through that a little bit and talk about what makes it legal for us to be able to do this. The benefits of using and being an acupuncturist. In other words, if you're not an acupuncturist, there are benefits for you to use an acupuncturist for these types of injections, and we'll go over that and why that's beneficial. If you are an acupuncturist, there's huge benefit for you to learn how to do these. And then we're going to talk about recognizing the need for different types of injection therapies. There's different types of injections and different types of solutions. We're going to stay within the holistic realm, by the way. We're not going to go outside into the world of pharmacology. Finding the right type of therapy and the right type of acupuncturist for you. And then if we have time, I'm open to taking questions. I know we have a presentation shortly after mine, so hopefully if we run beyond, we can just move to the side or out in the hallway. So in the state of Colorado, there's a legal allowance for us to now do injection therapy. And I believe, I'm trying to think, I was on the board, the A.C. board back in 2020 during the whole COVID thing. And there was just so much going on. I'm trying to think when this was voted in. I believe we worked on it in 2020. It was voted in 2021. So it's been at least 4 years that we've had the privilege of doing these injections. So there are some requirements. I'm going to put my glasses on because I can't even read my laptop. I'm going totally by memory here. There is a rule in there in our CCR 738-1 that says that injection therapy is the stimulation of acupuncture points, including trigger points, as we know as Usher points. Injection of saline, steroids, vitamins, minerals, homeopathic, glucose, lidocaine, procaine, serpin, and other similar substances that are manufactured for non-venous uses. In other words, we don't give IVs. We can use some solutions that can cross over between both, such as saline, but we don't do IVs. And anytime we use the word IA, that stands for interarticular, that's typically in a joint. IM is intramuscular, and IV is intravenous. So just as a refresher. So there's certain allowances that you must have and you must possess is you must have a license. I think that's only a given. Those of you that, if there's any students in here that are CCEMU students, I was a 2016 graduate, CSTCM in Pacific College, as you heard. So I believe they're teaching you a lot of this within your courses, and I think that's beautiful. You also have to have a clean needle certification. One thing that is not required, by the way, for PTs to do dry needling or for chiropractors to do acupuncture. And I think that there's a certain validity in having somebody know how to do a clean needle technique, and acupuncturists are trained in that, and I think that's beautiful. And of course, BLS, anatomy, physiology, all the things that are required in order to train for injection therapies. So the one important note that's important for anyone in here that's a student or a practitioner that is thinking of integrating injections into your clinic is please make sure that your malpractice insurance covers this, and it's important for you to call them or to communicate with them some way so that if there is something that is to happen, that you're covered. It's for your protection and for the protection of your patient so that they can get adequate care if something does befall them. So the different solutions, and this may be boring to some of you, so bear with me, we're gonna get to the good stuff. Some of the solutions that we can inject, of course, are different dextrose, glucose, enzymes except urokinase. Urokinase is used for blood clots. Of course, we would not work within that realm. Chinese medicine works pretty well with that. Homeopathic substances within the USA Pharmacopoeia. There are books that you can get at the library that will tell you what is the homeopathic pharmacopoeia within the US. Hyaluronic acid, this also works great for skin, and this also works great with some internal diseases as well. Minerals, pretty much any mineral that's injectable. Saline, Serapin, sodium chloride. Sodium chloride is saline water. That's if you're dehydrated and you go into the ER, they will typically give you 1% sodium chloride. There's also an injectable form of sodium chloride, and we'll talk about the studies on that. Tramiel, which is a homeopathic, works fantastically for inflammation in joints. Vitamins, cyanocobalamin, not my favorite form of vitamin B12 because it does have some forms of cyanide in it. So if anyone is taking cyanocobalamin, I recommend that you throw it in the trash and take methylcobalamin. Lidocaine, which again is 100% chemical and does have side effects. I don't use lidocaine in my clinic. I only use procaine, marcaine. Of course, marcaine, which is a bupivacaine hydrochloride, and with or without EPI. The only benefit of epinephrine is that it extends the length of time that that anesthetic works. So you will have to be cautious with somebody that has a cardiac issue, as epinephrine can cause an increase in heart rate. And certain oriental herbs, which only those who have done Chinese medicine and are certified in herbs can do oriental herb injections, procaine and B12. So there are some great benefits of using acupuncturists for injection therapies. And I know many think that going to your doctor and getting injections, that's the only people that can do it, and that is not true. When we think in the world of pharmacology, absolutely. If you want to go and get a cortisone injection, we don't do that as acupuncturists. That's not our jam. But we can do other things that work just as well. And they're homeopathic and they're natural. And one is Tramiel. And Tramiel is a homeopathic derivative, and it works great for all types of inflammation. I typically use it for carpal tunnel. Usually for those of you that are practitioners, at PC7, PC6, because of its direct connection to the median nerve. And it will travel into the carpal region, which will lower inflammation. Remember, it's not the nerve's fault that you have carpal tunnel. It's the other muscles and ligaments that are surrounding it that are on fire and that are inflamed, that are pinching that nerve. It's not the nerve's fault. So finding a way to calm down the inflammation is very important. Acupuncture is amazing for that. Also understanding the nerves of the arm and of the neck and of the brachial plexus up in the shoulder and in the neck. Don't just blame it on the median nerve as it goes through the wrist. That's like, I don't know, trying to put out the match fire with the bonfire burning your house down. So we use Tramiel to help lower that inflammation in that wrist area. Works very, very, very well. So why would you use an acupuncturist? Well, they have to have either a master's degree or a doctorate. You can practice acupuncture medicine with just a master's degree. But the majority of acupuncturist practitioners are headed into the doctorate realm. Acupuncturists are specialists in the use of acupuncture needles, and usually there's no guessing involved. We're pretty good at knowing where we have to put them, why we have to put them there, and how deep we go and how we manipulate. And this is very, very important because there's many different specialties of medicine out there that they're not trained the way we are. So finding a very good acupuncturist is important. They have more training and awareness than other medical professions do on the use and the healing benefits of acupuncture. I was talking to a lady the other day, and I'm actually going to hire her. She's very, very smart. She works within the VA community, and she says that many of the doctors in the VA now with no acupuncture training are putting acupuncture needles in. Number one, that means that they like our medicine. That made me happy because they know it works, right? But they don't have enough people that are doing it on veterans where they have to do it themselves. And that's kind of scary because there's a lot of things happening underneath that needle. I think doctors are somewhat astute, but there's many within that field who do not know why or where they're putting something, and they're just going for it. So that was a little shock to me, but it was also made me feel a little proud of the fact that our medicine is making an impact even within allopathic medicine. Acupuncturists aren't just trained in musculoskeletal issues or trigger points or dry needling, but they are also trained in internal medicine, neurology, and in some areas of mental health. And that's a benefit when you can get a person that's trained in all of those areas, know the power of acupuncture, and basically can assist you through all these different phases of healing. Dr. Klinghardt once said that there's 5 levels of healing. At the bottom of that is your physical. So physical is at the bottom level of healing. Above that, we still have mental, emotional, energetic, and spiritual. And so in the world of acupuncture, you can kind of hit all of that waterfall of healing. And that's important. When you go to your doctor, all they care about is either your mental or your physical. Typically, the degrees of acupuncturists make them an expert in many areas of holistic medicine. And holistic medicine is getting more and more recognition for its ability to heal. One small step in that is functional medicine. Even though they still cross over into the world of allopathic, they are headed into the realm of alternative or into holistic medicine. Acupuncturists are experts with acupuncture needles. And with the right training, they can become very, very proficient with IV needles or injection needles. There is a lot of difference between those two needles, but needles in the IV field are very, very helpful and can help acupuncturists with their diagnoses and treatments. And we're going to talk about that. Many are trained in the areas of sports medicine, orthopedics, neurology, musculoskeletal issues, and pain. We know pain. If there's one profession that knows pain, we know pain. And we know what causes pain, and we know how to move chi and move blood to help prevent pain and to resolve pain. The method of diagnoses for excesses and deficiencies, which is what every practitioner learns in Chinese medicine school, makes injection therapies a unique tool for an acupuncturist. Patients can benefit from their education and training and their holistic mentality. So there is a need for different types of injections. And before I go into this, I just want to say that acupuncture is my jam, okay? I love it, and it is very effective. Chinese herbal medicine is very, very effective. So when I talk about injection therapy, I'm not demeaning either one of those types of therapies because in and of themselves, they're very, very powerful. Holistically, these two are very successful in treating most conditions, if not all physical disorders. Injection therapies in a clinic is never considered a substitute for a great acupuncturist and a great Chinese medicine practitioner. Actually, injection therapies are supposed to work in conjunction with these two modalities. So why does it work for us? Well, we have hundreds of points available. Traditional acupuncture points, scalp points, Master Dong, Dr. Tan, and Osher points. Osher points pretty much leave you open to putting a needle anywhere you want to, within reason. So we have hundreds and hundreds of points available. Now, there are different injection types. So let's say we have nutritional injections. You've gone to the doctor, you need a vitamin B shot. They give you a vitamin B shot. We're allowed to do those. We're allowed to do, if somebody needs some vitamin D3, you're allowed to do that. Those are within the realm of vitamins and minerals. If we diagnose our patients according to excesses and deficiencies. Now, for people who don't know what this means, an excess would be, as an example, swelling or a fever. Deficiency would be somebody, I feel like that just turned off. That turn off? Yeah, it turned off. You think this one will work? Okay, sorry about that. I think the battery ran out. So an excess is something that you have too much of and you shouldn't have, that your glass is overflowing. And then a deficiency, whether it's in yin or yang, means you don't have enough. And the acupuncture practitioner's job is to help tonify you and to help you produce those things that you need. As we get older, the one thing I always say is my feet are always cold. My hands are always cold. By 7 o'clock at night, I'm putting a sweater on. I'd never done that before. And suddenly now I am noticing that I am a little deficient in heat. So this could be a hormonal issue, being as a woman, it could be my age. There's so many factors that could be involved here. So an acupuncture practitioner, based on their diagnosis principles, will say, oh, you're deficient in yang qi. So let's build up your yang qi. Then if we're dealing with injections in the world of pain and function, this is physical. Anesthetics will typically temper something down. That's like putting some, in Western medicine, that would be like putting steroids in, where it lowers inflammation. It would also be using lidocaine, something that would temper down a response. Saline actually helps to calm areas, but it also builds things up. It's both a yin and a yang. Dextrose, the same thing. Dextrose, we can use different percentages of dextrose. Dextrose, sugar water. We can use a 10%, a 15%, and a 50%. Each one of those percentages do different things. 10% calms your nerves down. If I inject 10% saline where your nerve is, it calms it down. It's like giving sugar water to a baby, just calms it right down. If I put 50% dextrose in a joint, it makes it activate and it tightens things up. And so we use those in loose knees. People whose knees are really loose, their joints are loose now. We put D50 in there and it tightens that up. If you have a weak lower back, they're like things are moving around. You inject D50 in there, it tightens it right up. So the percentage of dextrose matters. And then there's a formula called Prolotherapy, and we'll talk about that in a little bit. So I want to take as an example Zhusan Li, stomach 36. Those of you that are practitioners in here know that this is probably one of the most powerful points on the human body when it comes to acupuncture. It's both a tonifier and a sedating point. But it's known as a tonifying point because it helps stimulate our digestion. It's on the knee, for those of you that don't know. It's about 3 finger lengths below your kneecap on the outside of your bone. And it's what we consider a hussy point as well, which means it delves deep. And I'll talk on the next slide why it's called a hussy point. But it benefits the stomach and the spleen. It harmonizes our digestion. You know, the people are just like, oh, I just can't get my stomach to work right. Nothing wants to move. One day I'm this, one day I'm that. This point harmonizes the connection between our upper digestion and our lower digestion, stomach, small intestine. It also helps to tonify the blood. So we use this a lot in pale people, blood deficient people, people for some reason they have no energy. This is an energy moving point, so it moves chi. And it also builds up our immunity, makes our immune system strong. So this one little point pretty much fills a big range of different pharmacologies that we don't have to take, just one acupuncture point. So what kind of example that what we'd use if we found that somebody was deficient and we wanted to use this point? Let's say you've been treating them for 15 times and they're still not getting better. Well, you could consider an injection in there. You could do a vitamin B12 injection at stomach 36. And it will help with the neurological system and help build more energy. You could do a small injection of just some saline, and that would help tonify that point. You can put vitamins and minerals, magnesium. Magnesium is a #1 digestive mineral. Without magnesium, we can hardly digest anything in our body. Zinc. So we can actually use different injections to tonify this point, and you inject it in the point. So we can also use different herbs. If you're Oriental herbal medicine certified, but different homeopathies work as well. Well, let's get into how that works. So this is why it's called a H.C. point. For those of you that know, this is where the point is pretty shallow and then it delves in really deep. And so where stomach 36 is called the deep peroneal nerve. And this nerve has an origin. It comes from somewhere. It didn't just come from your leg. So this deep peroneal nerve is a branch of the common peroneal nerve, which goes up into and behind our knee. And then that is a branch of the sciatic nerve. And any of you who've had sciatica, you know all about that nerve and you're very much frenemies with it. That nerve is the size of your pinky finger. It's a very big nerve and has an origin too. It just didn't appear into your butt and into your legs. It goes into this realm called the sacral plexus. And that's the area on the front side of your sacral bone, which is that big bone that you feel down there below your waist. That's called the sacral plexus. Usually when we talk about a plexus, we're talking about a gathering of nerves where a whole bunch of nerves come in together and then they branch off in different locations. So stomach 36 can be used to treat sciatica because of its relationship to the sciatic nerve. Why does it work on the intestines? Because it goes to the sacral plexus. This is where neurology and Chinese medicine comes in. We're not just people that are out there sticking needles in people. We have intention. And the intention of a needle is knowing where is it going to go? How does it innervate? How does it react with the tissue around it? And what are the outcomes of that? So stomach 36 is a pain point because of its relationship to the sacral plexus. It works on digestion because of its relationship with the sacral plexus. So if you put anything in there that helps with that nerve, that deep peroneal nerve, remember deep means it's gone deep, H.C., right? Went down. Anything to do with that deep peroneal nerve, it's going to travel up into the sacral plexus and make a change. So that's one of the beautiful things about knowing one point in Chinese medicine and how to utilize that point for many different conditions. Sciatic nerve is the main cause of chronic lower back pain. I know because I see them every day. 50-50, neck pain, back pain, neck pain, back pain. However, what is starting to kind of win the race a little bit is this scapular pain that people are starting to feel. It's starting to win the race because too many people are looking at their phones and too many people are sitting on computers. So that one's winning the race. You know that pain that everyone gets right there? That's the one. And sciatic nerve is also one of the main causes of lower leg pain, weakness, and neuropathy. So when we treat neuropathies of the feet and of the legs, we have to, at some point in time, target that deep peroneal nerve. So what would an injection at stomach 36 or Zusanli, what would it do? Well, it would tonify the channel. That is the Yangming channel. That's the stomach and digestive channel and the blood channel. And it can also be used as a distal point. So obviously sciatica is here, but the point is here, right? So that's a distal point that's away from the original cause. But we know in Chinese medicine, we don't just treat where the pain is, we treat the channel. And this would be a channel treatment. It can also be used as a direct injection. So in other words, for knee pain. You know, people get that patellar tendinosis, or they have some meniscal tears, or they don't really want to go and have the knee replacement, so they're trying to get as long as they can without doing it. This is a great point, and injections in this point are fantastic for these issues. But you would also want to use stomach 34 and 35, by the way. So let's talk a little bit those. So what we just talked about were indirect sort of injections within the channel. But let's talk about direct injections. The main one that I do in my clinic is in the back. And the majority of the people that see me have degeneration, or what we call DJD, degenerative joint disease, spondylolisthesis with some radiculopathy. And what I'm basically saying there is your joint is degenerating and your vertebrae are sliding and you have no cushion in between them. And this is almost always a cause for low back surgery. But they're showing that low back surgery now has more side effects than what they originally figured, and that it really is not solving the problem. And so these natural injections, I have seen great success with them. I have kept people from having back surgery for years. So in Chinese medicine, this would be the governing vessel or the DU channel. Taiyang is our yang channel. It's a blood moving channel, an energy channel, and it goes in our back, down our back. It's also down here, right? Along the back of the leg. So we can treat the back of the leg to treat the back. And it has Shaoyang points with direct nerve connection. What nerves are those? Sciatic nerve, superior gluteal nerve, inferior gluteal nerve. This just means the nerve on the upper part of the bottom, the nerve on the lower part of the bottom. That's all that means. And then there's another group of nerves that this treats, is called the cluneal nerve group. And this is the nerve group that goes over the top of our hip bone that people always say they have pain there. So direct injections in these areas are beautiful. Takes the pain away almost instantly, lowers the inflammation. Now, it doesn't happen on one injection. It takes about 4. But the cost of those injections are the visit of 1 cortisone injection, in my clinic anyway. So I can give you 4 injections at $79 a piece, and that's what it would cost you to go and have 1 cortisone injection. And I'm not degrading the tissue. This reminds me of a study, and I'm going to bring a couple studies up here. I just read this the other day, and it was posted in the JAMA. JAMA is the Journal of American Medical Association. And they posted it. Since they posted this, then it must have had some significance. The study was comparing cortisone injections in the knee to just 1% saline, 0.9% saline, which is what you get when you go into the ER and you're dehydrated. Did the same amount, 1 cc of injection. They had the placebo group, and they had a control group, and then they had the group. So it was a study, a blind study. And I don't know how many participants, 170 participants, something like that. And then they compared, after 1 year, the cortisone group receiving 1 injection every 3 months, because remember, in medicine, they're not supposed to give you any more than 1 cortisone injection every 3 months. And if they give you more than that, that means that they're waiting for you to pay them so they can give you a knee replacement, okay? Because they know you're going to get a knee replacement if they do more than that. So 1 cortisone injection every 3 months or 1 injection of saline. And guess which one won? The saline group. The saline group won because of this, because cortisone had no change in pain levels compared to the saline group. And the cortisone level actually had a degeneration of tissue where the saline group did not. So here we have this very expensive pharmaceutical corticosteroid that doesn't work as effective as just saline water, salt water. I thought that was an amazing study, and most people are not being told this by their doctor. And I worked with nurses who are very holistic minded, and they're like, I hate giving this injection to people, but I'm told to. But I hate doing it because it's making their joints break down. But they don't give you saline injection in the doctor's office because it costs them about 3 cents. So corticosteroid, that 1 injection of corticosteroid probably cost them, I don't know, I'm going to take a guess here, $28. So therefore, they're going to bill insurance companies somewhere around $380 to do that injection. And they will get paid it versus 3 cents. So as acupuncturists, I don't know about you, but I mean, I have to make money because I have to pay my bills like everybody else, and I have 5 employees that I have to pay. But I'm not going to bill $380 for a 3-cent injection. And so these are the things, even though it was published in JAMA, most of us don't read JAMA. Most of us aren't privileged to having that prescription, or that subscription. Even though we can go out and do searches on it, but most of us don't. We take our doctor's word for it. He's not, just get a cortisone injection in your hip. It's probably your labrum. You probably tore the labrum in the hip. Let's just put a cortisone in there. Next thing you know, 2 years later, he's like, yep, got to have a hip replacement. Yeah, because it's a $13,000 procedure for him. He gets to go on vacation afterwards. So we know that we can direct injections in the back as acupuncturists. Number one, we know where the points are. We have these magical points called watojaji. And these watojaji points is right where the dorsal nerves come out of the spine. You have this whole group of nerves that come out, but you got these one little nerves that come up and they go right underneath the cutaneous area of the skin. And they're called these dorsal nerves. And you have ventral nerves that go behind the ribs, and they cause all these problems with pain. And it doesn't mean that you have degeneration in that area. It means that your nerves are really pissed off, excuse my French. And so we can go in there and put a little bit of 10% glucose, dextrose, and the nerves calm down. And you do that enough, you're reteaching neurology patterns in your back. Everybody's had that one morning where you woke up and go, I don't know what I did last night, but obviously it must have been fun because I really hurt today. And we don't know why. It happens in our neck. People, I don't know, right here, hurts. I don't know why. Sometimes it's just the nerve needs to be calmed down. It's not always a bone problem and it's not always a muscle problem. Sometimes it's just the nerve. And small injections of a little bit of dextrose or glucose help to calm that down. Even saline, salt water calms it right down. So these are some of the things that you can use locally as an acupuncturist or those that might be interested in this to ask for. Dextrose, prolotherapy, and we'll talk about prolotherapy, where we'll get to that. We'll talk about what it is. Saline, things like marcaine or procaine, things to kind of deaden the nerves. Maybe you just have this pain and you just want it to go away for like a half an hour so you can stand up here and do a presentation. That's what something like that would do. Marcaine would be perfect for that. And then hyaluronic. Why is hyaluronic important? That helps to build your joint back up. So if you have degeneration of the knee, you can build that cartilage back by putting hyaluronic acid in there. And a lot of orthopedists will do it only if you ask for it. They don't make any money off of it. I can buy a whole bottle of HA for injectable, I don't know, somewhere like 60 ml bottle, and it will cost me $200, and I can get a lot of injections out of that. And so HA typically, or hyaluronic acid, is not something that your doctor is going to recommend first time around. They're going to ask you to do something like gelsum, which is the coxcomb injections, those sort of things. And those work good too. I would definitely recommend those before a knee replacement. But there's so many other things from the natural realm that your body can actually process, use, and kick off when it doesn't need it without major side effects. Hyaluronic is also used for the face, by the way. You can do small injections under the skin, sub-Q, and it will actually help build collagen in the face. And it was used as a natural treatment in many facial surgeons' offices for that. So finding the right therapeutic. So let's talk about procaine. These three here are my faves. I'll try to go quick. So procaine is widely used in naturopathic medicine. I have been trained to do injections into things called the ganglia. So there's this area here behind the neck, what we would know as stomach 9. This one went dead too. That's okay. I'm just going to talk loud. Put my mom voice on. So being trained in injections into places like the stellate ganglia, which is a bundle of nerves that sits on the side of the neck. It has involvement with the major nerves of the neck, including the phrenic nerve, which helps us breathe, helps control our diaphragm. The vagal nerve, which, as we know, is our fight and flight and helps to calm us and helps us sleep at night. So the stellate ganglia, doing injections here with procaine actually helps people with PTSD too. There's been major studies that the injection of just 3 cc's on both sides helps people with PTSD not have an event, sometimes for months. And so in the field of naturopathic medicine, they're starting to use more of these types of injections. Doing an injection in the celiac plexus, which is this area right above the stomach, again, where a whole bundle of nerves sit that control our digestion, our kidneys, our heart, our lungs. This helps, an injection in there can help regulate the digestion and calm the digestion down, especially someone who has hiccups and can't get rid of them. It's a wonderful point for that, and it just takes 6 cc's of procaine. So procaine is more than just an anesthetic. Procaine is a tonifier and a sedator. It's a wonderful, I guess it would be sort of like in the field of homeopathics, because it is a natural medicine with some chemical components. So it has both a tonifying and a sedating effect. 1% saline. We just talked about the benefit of saline with knees. And there's another study that was done out there, and this one was called the use of saline as a placebo for intra-articular injections in osteoarthritis. And anyone who has osteoarthritis in their knees knows how painful that process is. But just injections of saline calms that osteoarthritis down. And this was a major study that they did. This is a PubMed study. It's listed here on the bottom. It has been demonstrated repeatedly that it has an active analgesic effect compared to many drug regimens as a standalone injection. Now, how many of you have heard that from your doctor? And you're not. It doesn't mean that they're not that they're bad people. It's just that they're making more money off of other injections, and they've got literally 5 minutes with you, and they're going to choose the fast and most effective that they know. But knowing that in the world of acupuncture, we now can spend more time with people, understanding their conditions, deficiencies, and excesses, finding out in channel theory, what is the problem? We can now do these sorts of treatments. And I think it's very important for us to make it very well known to the public that we have alternative methods for these types of pain. The other one is prolotherapy, and I promised Joe I'm going to be real quick on this one. Prolotherapy is a combination injection of saline, B12, a little bit of procaine. Matter of fact, I use more than a little bit of procaine, and then a little bit of bupivacaine or marcaine as an anesthetic. And as this is injected into the joint, D50, so dextrose 50%, and as this is injected into the joint, we're doing many things that we just talked about, all of those individually, right? Saline calms inflammation. D50 tightens the joint. B12 nurtures the nerves. Everything in our body is controlled by nerves, and we have to nurture the nerves. That's what B12 does. And then we have procaine. Procaine's a tonifier and a sedator. So it has so many benefits in and of itself. And then of marcaine is just so that you can tolerate me doing the injection. Basically, that's what marcaine is there for. So prolotherapy, our own combination that we can put together, is way more powerful than stem cells. And then add ozone on top of that, there's no stopping it. No stopping in acupuncture. She can do everything. She or he can do everything. So it's most important to know that when you find the right acupuncturist, they know the right therapy for you. There's no guessing. So training is important, research is important, and don't be afraid. I tell people, call me on the phone, schedule a consultation, ask me questions. If I don't have the answer, I'll tell you I don't have the answer. But many times we can help naturally before somebody has to go through the chemical route for these types of injections. And so my time is up. You guys were awesome. Thank you for listening. I hope you learned something and encourage you to seek out a good acupuncturist. And those of you that are practitioners, I've got to, I'm not